everybody. Welcome to the highlights and successes from the Lake Superior QIN's Cardiac Health and Diabetes Care webinar. Thank you for your patience and understanding as we had to unexpectedly switch webinar platforms. I'm really glad you all were able to find us today. The full recording of this webinar and transcription will be available within the next 2 weeks on the Lake Superior Quality Innovation Network YouTube channel. Your host and speaker for today is Andrea Boucher. Andrea, the floor is yours.
Thank you, Lydia. Good afternoon, everyone, or good morning, depending on where you're joining us from today, and welcome to today's webinar. My name is Andrea Boucher. I am a program manager at MPRO in Michigan as part of the Lake Superior Quality Innovation Network, and it's my pleasure to be presenting our key highlights and successes today from our Cardiac Health and Diabetes Care initiative. A couple of the objectives that we will be going through today is really looking at the key accomplishments throughout the initiative and highlighting the available best practice resources that will continue to be available for you following the close of our current statement of work next month. And we'll also be sharing some information looking ahead regarding our future work and sharing some information about that. So Lake Superior QIN has served as a local change agent in Michigan, Minnesota, and Wisconsin. As many of you may know, you have likely worked with us for the past 5 years. And it's really to help CMS achieve national healthcare quality goals from 2014 to 2019. Lake Superior QIN is one of 14 QIN QIOs across the country, and we've helped to mobilize providers, partners, patients, and families to really drive quality improvement at the community level. But the work really could not be done without the engagement of providers across care settings to improve the lives of beneficiaries throughout each of our 3 states. So in celebrating our successes, we really want to recognize the work of all of our partners who have worked to achieve quality outcomes for Medicare beneficiaries within our state. So that's definitely a shout out to each and every one of you. So beginning with the Cardiac Health Initiative, so how did that initiative come about? In August 2014, Lake Superior QIN began our current work to improve cardiac health and to reduce disparities in Michigan, Minnesota, and Wisconsin. CMS recognized the importance of focusing on cardiac health as heart disease and stroke and other cardiovascular diseases account for 1/3 of all U.S. deaths each year. Lake Superior QIN has worked to reduce preventable risk factors, so that was including high blood pressure, high LDL cholesterol, smoking, poor nutrition, lack of physical activity, type 2 diabetes, and obesity, especially for those groups that are affected by health disparities. So what have we really done in the past 5 years? We've recruited more than 880 clinicians within primary care practices and also 72 home health agencies across our 3 states to achieve the goals of the Million Hearts campaign and improve the ABCS measures, which are aspirin as appropriate, blood pressure control, cholesterol management, and smoking cessation. So by achieving those goals, eligible clinicians were not only improving patient care, but they were also well positioned for success in the quality payment program. So there were many benefits to participating with us in our cardiac health initiative throughout the past 5 years. So along with the goal of improving the ABCS measures, we also work to improve cardiovascular clinical outcomes through the improvement of clinicians' technical skills. So many of you have likely completed our competency trainings, which I'll touch more on that in a little bit. Also reducing disparities in care, so focusing on underserved populations, and optimizing the use of electronic health records to leverage technology to improve care and also improve patient self-management through patient education materials that are available. Many of you likely know the successes of our cardiac health initiative if you've been working with us for the past 5 years, But some of the ones that I do want to highlight is that 97.6% of our participating practices have implemented a blood pressure protocol. So that is a really great accomplishment across the board for all of those clinics who have been working with us. We've encouraged and assisted practices in using standard treatment protocols to improve blood pressure control by clarifying titration intervals that outline new treatment options and expanding the types of staff that can really assist in timely follow-up for patients who may need to be diagnosed with hypertension or those that may need titration for their meds. We've also seen an 11% improvement in clinician knowledge. This is within our blood pressure competency trainings and hypertension management. So nearly 400 clinicians have been trained through this program, so it was a really great success, and obviously we've seen a really great improvement in knowledge, so we're very proud of that. In addition to our successes, I did want to highlight various resources that we have created that will continue to be available to you. Highlighted on this slide are the Power of Lifestyle Modifications and Accurate Blood Pressure Readings posters. So those are available as part of the Hypertension Management Toolkit, and that's currently available on the Cardiac Health page on the Lake Superior QIN website. So those resources should be available likely until the end of the year, so if you do find any of those resources helpful, please download those and save the ones that you find most useful so that you have those handy and available to you. We also have our recorded learning sessions that will be available. Those are housed on our Lake Superior QIN YouTube channel, which has every virtual Learning in Action Network event that we have hosted. Highlighted on here are just a few key presentations, but you can always browse the YouTube channel to find recordings of any event. Some of the ones I wanted to highlight are improving patient adherence to blood pressure self-management, using self-measured blood pressure monitoring to diagnose and manage high blood pressure, and Everyone Loves a Quitter, focused on tobacco cessation. So those are just a few of the recorded sessions that we have that are still going to be available to you. So what are our key takeaways from the past 5 years of the Cardiac Health Initiative? First thing is to definitely have a hypertension champion identified in your organization. So this person really serves as a clinical staff educator and interfaces between facility quality management staff and also their peers to really promote excellence in blood pressure measurement and documentation. So making sure that you have a champion identified will really help to drive this work and continue it moving forward. Also, ensure that you have a blood pressure protocol in place and that it's being followed by all members of the care team. Complete annual assessments of your protocol are also helpful to ensure that it's accurate and up to date with current guidelines, and to also do a reassessment of your team's knowledge of the blood pressure protocol. You can also check out Lake Superior QIN resources that will continue to be available to you on the website that's highlighted on the screen. So lsqin.org/initiative/cardiac health. So we have worked diligently together across our 3 states to improve cardiac health outcomes, but we know that there are some differences based on geographic regions. So I just wanted to provide some state-specific highlights of items that are available and things that we've provided within each of our respective states. So in Michigan, many of you participated in our blood pressure competency training or tobacco cessation counseling training programs. With those, we definitely saw a tremendous amount of growth and improvement, and we really encourage you to leverage the resources in your organization to host your own competency trainings. All of the materials that are highlighted here and that are related to each of these trainings are available in the Hypertension Management Toolkit on the Lake Superior QIN website, and they're available for download, and you can take them and modify them for your own organization to continue annual competency trainings moving forward. Over in Minnesota, some key highlights are the partnership with the Minnesota Department of Health, Health Partners Institute, and the Institute of Clinical Systems Improvement. And that was to form a community collaborative to focus on hypertension control and tobacco cessation interventions. So in Minnesota, we worked with over 30 physician offices, which actually turned out to be about 500 providers. And what we did in Minnesota was provided initial leadership team and electronic health record assessments for each physician office site, and that is highlighted on the screen. And 100% of physician offices either were already using or started using a blood pressure protocol. A huge success was that physician offices that were not using a blood pressure protocol improved their hypertension control measure within the first 2 years by at least 4% after implementing a protocol within their practice. So it really does make a difference to make sure that the work is standardized and that all members of the care team are following the same protocol. And a successful resource created in Wisconsin is the e-learning modules. So a few of the resources available there is the Taking an Accurate Blood Pressure Reading module. So this e-module helped to explain why accurate blood pressure measurement is critical to correctly diagnosing and controlling hypertension. Also to prevent the most common blood pressure reading preparation errors. It also was able to demonstrate the proper technique for taking an accurate blood pressure reading and to describe measurement considerations for specific patient populations. And another e-module that's available is related to self-measured blood pressure, and that highlights how you can explain to a patient why self-measured blood pressure or SMBP at home is really important, and to describe what the role of SMBP is in medication adherence. Motivational interviewing techniques and health literacy were also included in this e-module to educate patients on SMBP. And also, it describes a technique that a patient should use to accurately perform SMBP within their home setting, so making sure that they understand proper positioning and the proper protocol to take their blood pressure at home. And also describes the guidelines for self-measurement frequency and reporting. So what does the patient do with their information when they take their blood pressure at home? How are they providing that back to their physician office? So a few key success stories that we want to highlight. The e-learning modules have been used in various practices in Wisconsin, and that was helpful in increasing clinical quality measure performance rates, and also helped with staff confidence in taking blood pressure readings. So making sure that staff is doing the same thing on every patient every time. These e-learning modules are also available as part of the hypertension management toolkit, and like I said, those are available on the LSQIN website. So switching gears a little bit to the Diabetes Care Initiative, that also began back in 2014. Lake Superior QIN began to work to improve the health of patients with diabetes and to reduce disparities in Michigan, Minnesota, and Wisconsin. More than 30 million Americans have diabetes, and another 84 million U.S. adults have prediabetes. So that was why this was such an important focus from CMS for us to work on this initiative. A person with prediabetes is at high risk of type 2 diabetes, heart disease, and stroke. And a person with diabetes is at high risk of heart disease, stroke, and other serious complications such as kidney failure, blindness, amputation of a toe, foot, or leg. So in the last 20 years, the number of adults diagnosed with diabetes has more than tripled in the U.S. population. And the U.S. population has become more overweight. So that is why this was definitely a key area of focus for us within our current initiative. So Just for an overview, we worked with partners, including state health departments, area agencies on aging, to promote one-stop shop resource sites to be able to locate and sign up for diabetes self-management education workshops. So partnerships were definitely key as part of this initiative, and definitely got us off the ground and running in order to provide diabetes self-management education to Medicare beneficiaries. So some of the goals of the Diabetes Care Initiative were to empower patients to really manage their diabetes through working with clinician offices as well as working directly with Medicare beneficiaries. We also focused on improving clinical outcomes related to A1C, lipids, eye exams, weight, blood pressure control, and foot care. We also focused on increasing the number of certified diabetes educators and diabetes self-management education classes within our states, and also to increase participation and graduation from those classes. Some of the successes we'd like to highlight is that within our 3 states, we graduated more than 2,800 Medicare beneficiaries from a diabetes self-management education program. As part of that program, participants completed a pre and a post test in order to assess their knowledge and their experience in living with diabetes. And what we saw with those was a 132% increase in the number of beneficiaries who knew healthy ways to handle stress from having diabetes from the pre to post test scores. So we could really see that the workshops that we were providing within each of our states were definitely making a huge difference in the lives of Medicare beneficiaries who were living with diabetes. In addition to our successes, there are various resources that we have created that will continue to be available for you. Highlighted on this slide are the 3-minute foot exam and the Take a Seat and Show Me Your Feet posters. If you have participated with us in the Diabetes Care Initiative, you should be receiving a mailing, and that will include posters for diabetes foot care in English and in Spanish, and it will also have an opportunity for patients who may be visually impaired to have an audio version of the content that's on those posters. So if you have participated with us, you should be receiving those in the mail, so please be on the lookout for that. As I mentioned before, our Lake Superior QIN YouTube channel houses every virtual Learning in Action Network event that we posted. These are just a few key presentations that we would like to highlight specifically related to diabetes, but you can always browse our channels to find recordings of any event. These videos will continue to be available to you. A couple of the ones highlighted are motivational interviewing basics, and that was specific to chronic health conditions. The standards of medical care in diabetes, so an update for the 2019 guidelines. And also making the diabetes and oral health connection, so how your mouth is really part of your body. So that was an interesting presentation. So please feel free to browse any of those resources on our YouTube channel. Diabetes self-management education workshops are a resource that will continue to be available to patients. So each state within Lake Superior QIN has partner websites that house all of the workshop information that's available to patients. So those are each highlighted on the screen here. In Michigan, you can visit My Healthy Programs, myhealthyprograms.org. In Minnesota, it is yourjuniper.org, and in Wisconsin, it's wisconsin.wihealthyaging.org/workshops. So each of these websites interfaces a little differently and has various information, but should a patient be interested in attending a workshop in the future, those are housed on each of these websites, and you can find local resources that would be available to your patients. So some state-specific highlights that I'd want to mention is in Michigan, there were 1,298 graduates from a DSME workshop from August 2014 through January 2019. The map you see here highlights all the areas where there were at least one graduate from a diabetes self-management education workshop. So as you can see, there was a great amount of reach throughout the state of where these patients were coming from. So we were able to reach a wide variety geographically through the diabetes self-management education workshops provided in Michigan. We also worked to collect clinical outcome information on 10% of our graduates from the program, and all of these showed positive results. In addition to that, we looked at the pre and post test data, and that revealed that the number of people who felt that they could make a plan with goals to help control their diabetes increased by 33%. The number of people checking their feet daily increased by 28%. And the number of people reporting that they exercise at least 6 days per week increased by 15%. So we saw great improvement within our attendees from our DSME workshops here in Michigan. Over in Minnesota, there were nearly 500 completers in a diabetes self-management education workshop. Of those that completed a pre and post test, there was a 29.7% increase in the knowledge of healthy ways to handle stress related to diabetes, and also an 11.4% increase in the knowledge of good foot care. Some of the key important highlights is the partnerships with the 7 area agencies on aging, local public health, health plans, and community service organizations. And those partnerships really helped to lead to the successful completion of workshops. So like I said, this Diabetes Care Initiative was very reliant on partnerships in order to make our success. So some state highlights in Wisconsin, both the DEEP and the DSMP curriculum were utilized, and with those programs, that was able to reach 985 graduates. The map shows the reach across the state of Wisconsin, and again, here you can see that there was a pretty vast reach across the entire state for those DSME graduates. The pre and post test data in Wisconsin showed an increase of 46.1% of people who felt that they could make a plan, 19.2% of people who check their feet daily, and also a 50% increase in people who exercised at least 6 days a week. So we really could see the value in delivering the diabetes self-management education workshops and how this is really impacting the health and the lifestyle choices of those people who attended. So a lot of great successes there. Through the offering of the workshops, we really found that participants in all of our states really had a deeper understanding of what their doctors and their diabetes educators have asked them to do in order to manage their diabetes. So participants were really able to ask questions that they might not be able to ask their doctor, and also gained knowledge of self-management techniques and different ways that they could handle stressful situations in case things were to come up. Participants also really expressed a lot of gratitude to their peers in the workshops. They were really grateful for all of the support and how they each learned together and learned from not only from the leaders, but from the experiences of other participants as well. We also saw really great success of this model in the rural community in Wisconsin, and the Diabetes Advisory Committee started a peer education program at Richland Hospital in Wisconsin, and their staff were trained in the DEEP program, and they held free sessions to educate community members, and that was beginning back in 2016. So that was a really successful program and a great way to get deep workshops out to even more patients who are in need of that program. So those are just some key highlights and successes. If you would like to see more, you can visit our website at lsqin.org/success-stories. And I'll kind of switch gears a little bit and talk about our future work. So what does the future of Lake Superior QIN look like? For 2019 through 2024, CMS has outlined 5 broad categories for the QIN QIO program. So those are including behavioral health outcomes, and that has a focus on decreasing opioid misuse. Also increasing patient safety, increasing chronic disease self-management, increasing quality of care transitions, and improving long-term care quality. So with that, Lake Superior QIN's partners, which are MPRO, Metastar, and Stratus Health, we just want to thank you all for your hard work to really advance the health and healthcare of your patients with us for the past 5 years. We're looking to the future of improving quality on behalf of Medicare beneficiaries, and our 3 organizations have entered into a new partnership called Superior Health Quality Alliance, or just Superior Health, which is strengthened by the addition of the Illinois Health and Hospital Association, the Michigan Health and Hospital Association, Midwest Kidney Network, Minnesota Hospital Association, and Wisconsin Hospital Association. So each organization has success driving the achievement of Medicare Quality Improvement Program goals as either a quality improvement organization, a hospital improvement innovation network, or an end-stage renal disease network. So Superior Health members currently are improving healthcare in Illinois, Michigan, Minnesota, North Dakota, South Dakota, and Wisconsin, and have experiencing improving healthcare nationwide. So as Superior Health, we are aiming to support the Centers for Medicare and Medicaid Services in improving the quality of health and healthcare delivery for consumers, providers, and communities in our region across the U.S. And with that, I think I will open it up for questions today. I have included contact information for some state-specific contacts should you have any questions related to any of that information. But since we're using a different system than normal, I will have Lydia come back and explain the options for submitting questions.
Thank you, Andrea. So if you do have questions today, please use the chat function and send the questions to everyone. We'll then go through the list and get to as many as possible. If you do want to ask your question out loud, just leave a note saying that, and we will, once we get to your question on the list, I will just unmute your mic and you'll be able to ask your question. So please start asking questions now.
Thank you, Lydia. I'll just give everyone just a few minutes to see if we get any questions in the chat. And if you do, like I said, if you do think of a question following today's webinar, you can always reach out to contacts, any of these contacts listed on the screen.
All right, I will also at this time add the link, the evaluation link into the chat, so in case people do have to head out and aren't able to stay for the questions portion or don't have any questions to ask, you can get that link. I will also be sending a follow-up email with this link as well, so if you don't grab it right now, you will also get an email later with the evaluation.
Thank you, Lydia. So I am not seeing any questions in the chat, so I think we will go ahead and wrap up for today. I just wanted to thank everyone for joining us today, and we really look forward to working with you in the future. Thank you.